Hi, I'm Dr. James Bissland. Welcome to Health and Information. This is our fourth in a series of chiropractic miracles. We've had the series 1 with doctors, series 2 was with some of the doctors. Series 3 was several patients who talked about miracles that have happened in their care. And number 4, we're going back to some doctors. We recently had an opportunity to sit down with a number of the top chiropractors in the United States to hear more about what's going on in their offices. Chiropractic miracles happen every day. Happen in chiropractic offices all over the country and all over the world. So today we have a series of doctors and office managers who have some really nice, interesting, fun, but miraculous stories to tell. And our closing story today is a very special one that you won't want to miss. Our first doctor is Dr. Dan Tubbs, and he's going to be talking about radicular pain.
Hi, I'm Dr. Tubbs from Cuyahoga Falls, Ohio. I wanted to tell you about some of the miracles we've experienced in our office. We've got miracles happening all the time. Some of the things that I'm most proud of and what we have excellent results with is patients that come into the office with radicular pain. And a very high percentage of the time that's due to disinvolvement, arthritis, and possibly a herniated disc. And our office staff and the equipment we have is excellent in handling these types of conditions. So just to kind of give you an idea of what it takes, it does take some time to take care of these conditions. It often takes 10, 20 treatments to start seeing some progress. But the good news is we get results without drugs and surgery. So there is hope if you do have radicular symptoms and or if they're related to disinvolvement, specifically herniated discs.
Okay, well, thank you, Dr. Tubbs. You know, radicular pain is just one of the many things that chiropractors treat. As we treat patients every day in our offices, we see improvement in so many different types of conditions, so many different types of pain, as well as other health conditions. Dr. Chung-Ha Su, who was a researcher at the University of Colorado, had made some comments in discussing his research that when we remove the subluxation, we have improved health and a longer life. And this is something we need to keep in our forethought. Every time we see a patient, we adjust that patient. We turn on that vital energy. We turn on that life force and improve their health, but also improve their longevity and their length of life. Now, the foundation of the body is the feet. And there are 2 doctors that are with us today on our program that have stories to tell us about problems that they have seen in their offices with patients and their feet. The first doctor is Dr. Ted Conger from Salt Lake City, Utah, and Dr. Lana Pinnell from Independence, Missouri. They're going to talk to us about cases that they've had in their office with foot pain.
Happened maybe 5 or 6 years ago with a football player from the University of Utah that had been diagnosed with a condition called turf toe or turf foot. And what had happened was they had taken him, the trainers at the University of Utah, and worked with his ankles and his feet and had him out of games for 3 weeks. And of course they called me up as the team chiropractor and asked if I could do anything to have him back in the game by Saturday. This was on a Thursday. And we evaluated Jason. We were able to evaluate a calcaneus and a talus misalignment in his foot, and with some little bit of physical therapy and adjustments, he actually played in the football game 2 days later. So those are just a couple of miracles I wanted to share.
Another lady that we had came to me several years ago, and she had this horrible foot pain right into her foot and ankle area on the outside of her right foot. She had been to the podiatrist, she had been to the family doctor, and she kept telling him it's hurting, but they couldn't find anything. They told her it was all in her head. And when she came in to see me and shared that, tears were in her eyes. And that really touched me, because I don't want somebody telling me that pain that I'm actually feeling is in my head either. So I checked her out, and what we found was a subluxation in her ankle and in her foot. And as soon as we adjusted it, she had immediate relief and was able to walk normally and without pain. Now, I can't ask for any better results than that, that's for sure. And we're always happy to have people come in and have a look at what they have going on to see if we can help. And
All right, well, thank you, Dr. Conger and Dr. Pinnell. The doctors that you're seeing on these programs today are some of the top chiropractors from around the United States, a group of doctors that meets regularly to help to further enhance the practice of chiropractic for all of the patients and all the clinics that we have in our group. Our next doctor is going to talk about a very interesting case. He had a patient who had a very severe problem. He was walked in very antalgic, bent over, and this story is one that is really motivating. I've seen a lot of patients like this in my more than 28 years now of practice, and Dr. Pete Young from Missouri is going to tell us a story about a patient he saw in his office. So, Dr. Young.
Okay. Hello, I'm Dr. Peter Young here in beautiful, snowy Kansas City. One of my favorite, has to be my favorite miracle, was when I was just in practice, just started, and I walk up to the front desk and there's a gentleman bent over, all in black, and I didn't realize till I got there, but he was a Catholic priest, and he came to me, said, Dr. Young, the last time this happened, I was in the hospital 3 weeks, and it can't happen now. I got like weddings and all kinds of things I have to do. So he said, can you help me? And I said, follow me. And as I turned around, I said, Lord, help me quick. And he got some of the best results I could have ever dreamed of. He just said that if he'd known he'd have had this done a long time ago, he said, in over 30 years, he's had bouts off and on with it. So I was very lucky that I was at, the Lord worked through me, and it got to get him a lot of results, and he referred half the parish into the place. But I'm very thankful for Father Finnerty at St. Agnes Church. God bless.
All right, well, thank you, Dr. Young. Many chiropractors across the country do multiple type of care, and our next doctor is going to talk to you about treating a patient with cranial problem or cranial manipulation. And you all have met her before with our Miracles program, and she's back again for a couple of cases that she has in her office. So from Maysville, Kentucky, here's Dr. Rita Goldman.
Hi, I'm Dr. Rita Goldman from Maysville, Kentucky, and in case you didn't know, that's the center of the universe. Well, we've got some interesting stories to really share with you today. A few years ago, I had a lovely little Amish girl come to see me from up above Sandusky, Ohio, which from Maysville is really a long drive, okay? Her family brought her down, and she really wasn't talking. They'd had to take her out of school. She was sick. She was throwing up. This child was just going through a complete just wanting to be in a fetal position. She was had just reached that point. So we went ahead, we checked her out, x-rayed her, and started doing cranial treatments on her. Now the family lived so far away that when they brought her down, we would give her several treatments. Every day she would get one, and then they'd have to go back home and they'd get her back, but it was usually, I couldn't see her more than a couple of times every month or two. This went on for a year. She gradually came out of this, and a year later walked into the office, upright position, standing beautiful and tall. Her hair was fixed. She didn't have that disheveled look to her. She was talking. It was just like the sun had come down, was shining on her, and she'd gotten her life back. So we're so glad every day that we're chiropractors. If you haven't been to a chiropractor, try chiropractic, because you just cannot believe the difference that happens as innate comes through and those subluxations are removed and you get your life back. Thank you.
Oh, thank you, Dr. Goldman. You know, when people think about chiropractors and chiropractic care, they don't always think about some of these things like what Dr. Rita just talked about, or some of the other things that you're going to hear today on the program. But you know, whenever we deal with a nerve, wherever that nerve goes, it's going to create a problem with an interference to that nerve. So let's say, for instance, if the nerve coming out of the neck goes to the heart, or the nerve coming out of the mid-back goes to the stomach, and that nerve is reduced and it's not functioning normally, then we're going to likely have problems in the organs that those nerves control. Now, most chiropractors treat neck pain, and that's what a lot of people will talk. They go to a chiropractor, they have neck pain. We have a couple of interesting cases that doctors told us about on neck pain. So I want to introduce them. First, we have Dr. Darcy Stotts from San Angelo, Texas. And then again, we have Dr. Lana Pinnell from Independence, Missouri. And both of these doctors have had an interesting case of a patient who had some neck pain, and they're going to tell their stories for us on those particular cases.
Good afternoon. This is Dr. Darcy Stotts. I'm from San Angelo, Texas, and I wanted to share a really sweet story with y'all. We were lucky enough to have a patient come in the office. Grateful to see this little girl. She's 9 years old, and she's playing outside, minding her own business at the playground, and there's some kids on the monkey bars, and this one kid lands on her head. They had taken her to the ER, and at the emergency room, they did all these x-rays, of course, and I think they did a CT and MRI as well. And on those studies, they didn't see anything. They said she was just fine. She couldn't move her neck at all, and her mom was beyond concerned. She's a ballerina. She couldn't dance. She really couldn't even go to school and study. So when she came to see me, we did an exam and x-rays, and on her x-rays, it was very clear. She had misalignments at the very top part of her spine, which is where the brainstem is. That area was being choked off by misalignments at C1 and C2. When we adjusted her and started getting the neck moving again, she did amazingly well. She was a totally different child. She was able to study. She was able to move. Her neck and low back were actually better from just the neck adjustment, and now she's doing ballet again. So we were grateful to see her in our office, and we see kiddos all the time with problems. So that's kind of our miracle story of the week.
Hi, my name is Dr. Lana Pinnell from Independence, Missouri, and I wanted to tell you about a couple of miracles in our office. Recently, we had an older woman come back into our office after being absent for a couple of years, or maybe a year. She had to go live in a nursing home, and so we had not seen her. But she took a fall at a hospital in the bathroom where she was and injured her back and her arm, her hand, as she had fallen over the edge of a little shower ledge. And for almost a year now, she has had horrible vertigo, nausea, just really dysfunctional. She'd been to the medical doctor. She'd been to an ear, nose, and throat doctor. There was nothing they could find that was wrong. So her grandson recently brought her in and said, you know, this is it. You're our last hope here. So we took a look at her. We did some exams, did some x-rays, and found a horrible subluxation pinching the nerves in her upper cervical or upper neck. We went in and adjusted, and by the third or fourth visit, she has had greatly reduced symptoms. The nausea is practically gone, and we're just so happy because that's a huge quality of life change that she's been suffering with for almost a year. Thank you.
Thank you, Dr. Stotts and Dr. Pinnell. You know, neck pain is one of the biggest things with low back pain that we see on a regular basis in our office. And it's nice that most patients will get the benefit and the relief that they seek when we follow a treatment protocol for those particular conditions. One of the most unique things that I see in the office on a regular basis is kids who have problems with earaches and ear problems and ear congestion. And a lot of people will not look at chiropractic to help with those problems. But as Dr. Ted Conger is going to tell us, earaches and ear pain do respond very well to chiropractic, and we've seen those results on a regular basis. So once again, from Salt Lake City, Utah, Dr. Ted Conger.
Hello, my name is Ted Conger. I'm a chiropractor in Salt Lake City, Utah. He is about a young man, 3 years old, little boy from Salt Lake City. His name is Ethan. And Ethan was brought to our office because he was having earaches, ear infections, 1 or 2 every month. Sometimes he'd go 1 or 2 months without those earaches. And as we evaluated Ethan, we found that he had some subluxations in his upper neck area. And by working on those and adjusting those, we were able to see Ethan start to regain his health. His immune system got better and better. And as a result, the earaches that Ethan was having and the ear infections have completely gone away. Over the last year and a half since we started to treat Ethan, he's not having these ear infections anymore. So that's the first miracle I want to tell you about.
Thank you, Dr. Conger. As we go through all of these various symptoms and conditions that patients are bringing to the chiropractors that are in our program today, keep in mind that there are many other conditions, internal organ conditions, organic conditions, can all be helped by chiropractic care. Even if your particular symptom, or if you know somebody who has a symptom, is not listed in this program, check with your chiropractor and see if maybe we can help with those particular symptoms. At the end of our program today, we're going to have a listing of each doctor who participated in the program with all their contact information, so that should you have a problem and or you have a friend who has a problem, that you can refer them to see one of the doctors who is contributing to our program. As we move forward, another of the most common problems that we see in chiropractic offices is knee pain. And Dr. Rita Goldman's son, David Goldman, who is her office manager and kind of her right-hand person, tells us a story about knee pain. And so David Goldman is from Maysville, Kentucky, and he's going to tell you all about this particular case.
Hi, I'm David Goldman with Maysville Family Chiropractic, and I wanted to talk to you a little bit about some of the miracles that we see on a daily basis. We had a patient come in suffering from low back pain, but when we got to the root of the problem, we found that this patient was really suffering from knee problems. She'd been to multiple doctors because of her knee. She'd gotten her feet checked out because of her knees, and it was affecting her whole body. When this patient finally came in and started their treatment plan with us, it was the beginning to a new wonderful life for them. This patient hadn't been able to walk over 10 minutes in the past 5 years. I'll never forget the day that she was on the treadmill after she'd gotten her adjustment. She was walking, she was going over 10 minutes, the whole clinic was rooting her on, tears were shed. I mean, it was a wonderful day. But the thing of it was that she didn't realize when she first came in that chiropractors even treated knees. But yet, those were one of the first things that she started to feel better with. She was getting ultrasound on her knees, she was getting her knees adjusted, doing all types of wonderful things. So if you're ready to make a difference, go see your chiropractor today.
Hey, thank you, David. As we go through this program, we talked a few minutes ago about that neck pain and low back pain were two of the most common things that we see in a chiropractic office. Once in a while, it's very interesting. We start seeing somebody for one condition, and then as we go through the treatment program, they start telling us about other conditions they have. And sometimes they say, well, I didn't tell you about this problem, but since you've been treating me, it also is improving. I want to introduce a doctor who has a story to tell you about a patient who had low back pain and then also had headaches that he disclosed to him a little later on in his treatment program. I'd like to introduce to you Dr. Gary Wheat.
Hello, I'm Dr. Gary Wheat. I practice in Streetsboro, Ohio. I'd like to tell you about a case we've had in our practice. This is a gentleman that was an over-the-road truck driver. Came in to see me with a low back condition. We examined and x-rayed this gentleman and found a problem in his low back and began treating him. After about 10 treatments, we did a re-exam for this man, and he was feeling much better in his low back. And when I went in and asked how he was doing, he said, "You know, I'd just be feeling perfect. It wouldn't be for those headaches I'm having." And so I said, "Headaches? What headaches? You've never mentioned headaches to me before." So I said, "Would you mind if I check you and see if I can help you with these headaches?" He said, "Oh, Dr. Wheat, probably no need to bother. I've been to the Cleveland Clinic and the Mayo Clinic, and I've gone everywhere for these headaches. You see, 21 years ago, I was in an accident when I was driving my truck, and I got hurt, and I've had a headache ever since. So I've just figured I'd have to learn to live with those." And that's what the doctors told me. So I went ahead and examined him, found a problem up in his neck, and sure enough, within just a few adjustments on his neck, his headaches cleared up. And following up with this gentleman several years later, the headaches were still gone. So it was a very exciting time in my office for me and for this patient. Thank you.
Thank you, Dr. Wheat. We see that kind of a situation happen in our offices all the time. And remember, if you don't tell your doctor what's happening with you, you don't tell them what's going on, good or bad, we can't help you, because we can't help something we don't know about. Staying on the theme of headaches, a lot of times we have a patient who has headaches, and they also then with them have either neck pain and or upper back pain. Dr. Rita Goldman had such a case, and she would like to tell you about it. So once again, from Maysville, Kentucky, I'd like to introduce Dr. Rita Goldman.
Hi, I'm Dr. Rita Goldman from Maysville, Kentucky, and I'll tell you something, I love being a chiropractor. We have the most wonderful results with people. Recently, I had a gentleman come to see me that lived 2.5 hours south of us down in Menifee County, Kentucky. This gentleman has had headaches since 1981. When he came in to see me, he said he had headaches, but he also had this profound pain in his upper back, and he felt like the headaches were really coming from that pain in the upper back. So we proceeded to give him a treatment after he'd had his consultation, his evaluation, and his exam and his x-rays, and he felt much better when he left. Little did I know I wouldn't see him for another 3 weeks, and when he came back, I said, "Well, how are you doing?" And he said, "Well, you know what? I didn't have headaches for 2 days after that first treatment." And I said, "Well, I'm sorry, it didn't last longer than that." And he said, kind of talks like this, he said, "Well, honey," he said, "that was good." He said, "I've had these headaches since 1981. That was the first time I've had 2 days without a headache." So if you've got headaches, try chiropractic. There's nothing like it.
Thank you, Dr. Rita. As we look into so many different conditions that we can treat, some of them are just really kind of what I've had patients say, that's kind of out there. And the next one is kind of out there when you think about this particular condition. You don't think about chiropractic. But I want to introduce to you Dr. Randy Fick from Cincinnati, Ohio. Is Dr. Fick's going to talk about a patient that he saw who had bedwetting. Now, bedwetting is one of the conditions that people don't always look to us for, but a lot of times there's a nerve interference from the spine to the bladder, which can cause the malfunction. So Dr. Randy Fick is going to tell us about a case he saw in his office that was helped by chiropractic.
Hi, I'm Dr. Randall Fick in Cincinnati, Ohio, and today we're going to talk about bedwetting. A lot of people have bedwetting, especially younger children, and what a lot of people do not know is that bedwetting can respond very well to chiropractic care by treating the lower lumbar spine, the area that's related with the autonomic nervous system, to the bladder. When you do that, and then you also stimulate the acupuncture points in the fifth digit of the finger and some other bladder acupuncture points, it's not long before the patient typically shows an improvement. I had a young girl who was 13 years old, and she was going to go to camp, and she was afraid that she was going to wet the bed, her pattern is that she wetted the bed every night and has so for years. We started treating her lower back, stimulating the bladder area, and also did acupuncture points in the hand using Korean hand needles, and then also teaching her how to stimulate the points in her hand before she goes to bed. And within about 2 visits, she already made an improvement, and within 1 week, she was no longer wetting the bed. So there's another miracle story about how chiropractic, and in this case acupuncture, can help treat the bedwetting.
Thank you, Dr. Fick. Continuing on with that same theme, I want to introduce to you from California, Dr. Bruce Holmes. And Dr. Holmes is going to tell us a case about frequent nighttime urination. And the patient basically came in with low back pain. But some of these other things, again, like we talked about a few minutes ago, other symptoms showed up or were disclosed. So Dr. Bruce Holmes is going to tell us a story now that happened in his office.
I'm Dr. Holmes from Burbank, California. I'd like to tell you about a case history of a patient who came in for low back problems, but in the process of taking his history, he said that what was most debilitating was the fact that he got up at night to go to the bathroom. So I asked him, "How many times do you get up to go to the bathroom, Sam?" And Sam said, "About 8 or 10 times a night." In which case, I asked him why he didn't just put a pillow beside the toilet so he could sleep in the bathroom, because 8 or 10 times a night generally meant that he was going to be sleeping at most half an hour at a time. So in the process of evaluating his low back, I wanted to ask him whether he wanted me to help him so that he wouldn't have to get up at night to go to the bathroom. At which point he said he had been getting up 8 or 10 times a night to go to the bathroom for at least 10 years, in which case I thought this guy must have one whale of a sleep disorder. So over the course of 4 or 5 months of treatment, not only did his low back pain become better, but gradually he began to sleep without getting up so many times to go to the bathroom, not realizing that the nerves in his lower back were controlling everything about his body functions from his belly button down. So at one point in the process of his treatment, at about 6 months into the process of treating him for his low back condition, he came in and announced to the world that he slept like a baby and didn't get up at night to go to the bathroom at all. However, there was an elderly lady in the waiting room who said, "My goodness, young man." Now, Sam was about 65 years old. She said, "My goodness, young man, does that mean you got up in the middle of the night and cried like a baby and peed your bed?" However, Sam was so elated that he was able to not have to get up at night to go to the bathroom. He just kind of sloughed off the funny comment and was quite happy by the fact that not only was his back feeling better, but he could sleep 8 hours or 7 hours without needing to get up in order to go to the bathroom.
Thank you, Dr. Holmes. As you've been able to see from the different doctors and their discussions here, we see a lot of different things in our offices every day, and I guess that's probably one of the reasons that a lot of chiropractors pretty much stay excited and enthused about their practice from day to day, because it's not the same routine every time you turn around. You got something different, and whenever a patient walks in for the first time, we really don't know what to expect. And so I kind of look at it in my office like I'm an investigator, that when they come see me, we investigate, try to find out what's going on. We always look for the cause of the problem. And we, of course, as chiropractors, we look to the spine for the most part for that. You know, one of the things, and probably the toughest thing for people to understand, is that healing can take time. Sometimes we give a treatment plan for 6 months, sometimes we give them for 4 months. I've given treatment plans for years. I have a final program, or a final doctor who is going to talk about a very, very interesting case. And this is a child, and I'm going to let him tell the whole story because he tells it a whole lot better than I do. The doctor that is going to tell us the story, his name is Dr. Rolla Pinnell. And Dr. Pinnell was a chiropractor from Independence, Missouri. He practiced there for many years. He also ran a practice consulting group for many years until he passed away in 2004. But Dr. Pinnell was giving a lecture to a group of chiropractors and talked about this one particular case of a child that he treated for quite some time. And I'd like you to see this story and understand that sometimes it just takes time to get problems corrected, especially significant or severe problems. So with that, I'd like to introduce to you Dr. Rolla Pinnell.
So in desperation, they brought the child in. Now this kid is maybe 8 or 9 months old by this time and is a vegetable. I mean, that's a kind word for the state the kid was in. And they said, "Can you do anything for this?" And I said, "Let me look and see." And I checked the child out, and I could see a lot of things that need to be done with the spine. I also knew it was going to be tough and difficult. You're dealing with a vegetable and a growing child and all that. And I said, "There's a lot of spinal work needs to be done here. I have no idea what the outcome would be. But if this were a child of mine, I would do everything I could for that child." And they said, "Would you take the case?" And I said, "Yes, I will." And then after I said that, they said, "Well, we have a problem." Guess what it was? "We have no money." I said, "That's not important, you know. What's important is, does the child need to work?" So we started in. Now, every day, they carried this baby in on the pillow. Sat in the reception room. We finally got around. I gave an adjustment. We adjusted it every day. And every day we get some results. But, you know, it's constantly recurring spasming and that sort of thing, contracturing, and the kid's drooling, and it goes on, all the bad things. And this went on. We treated the baby for a year. And at the end of the year, spine was a lot better, but nothing. And they were constantly being advised to put the baby away and asking my advice. And I said, "That's a decision I can't help you with. I can just tell you that I'm working on the kid's spine, and if you can handle it, I can handle it. Let's keep going." I'll speed this whole story up. The crux of it was, at the end of 2 years, we're still seeing the kid every day, except maybe an occasional Sunday or something. And the child is growing all the time, you know, but he's not going anywhere up here. When he was 5 years old, we were still treating him, and he said his first word, "Duh." When the kid was about 8, he was beginning to be able to sit up. Carry on with the story. Eventually, that spine got better and better. Now, we're talking about thousands of adjustments. But at 19, the kid graduated from high school, and he's alive and well and doing good today.
That's quite a story. And I've told the basics of that story to several patients who have had children who have had pretty significant problems. And when you give a patient a recommendation for a long treatment plan than they maybe would have anticipated, the end result is what's important. And I want to thank Isla Kelton and the MDC group for their permission to allow us to use that video segment that we did. that was a story that when I saw it several months ago for the first time, it really kind of touched me in very deeply, that you take patients who are really on their last resort, and you've heard that earlier today as well. But people who come to us as a last resort, they don't have any other alternatives, and they get well. They get the problem corrected, or at least improved, if not totally corrected. One of the things that I find very important, and this is one thing I tell the patients, is you do have to give time. Healing takes time. A problem that's been there for years, or a very significant structural or biomechanical or neurological problem, isn't going away overnight. But with time and patience, most of these problems will improve or be corrected. I want to thank all of our doctors for taking the time to give us their stories again this program. And all of you who are watching, I'd like you to take the opportunity to help somebody you know that's suffering by introducing them to your doctor of chiropractic. Or if you don't have one, in just a few minutes, all of our doctors are going to have their contact information on the screen. You will be able to contact them directly, tell them that you saw them on Health and Information, and talk to them. Listen to them. These are dedicated doctors. Every one of them I've known personally for many years, and every one of them is here to help you and your friends, as we all are. Thank you for joining us. I'm Dr. James Bissland. Have a healthy, happy, and safe month.